Hello, everybody. I am Frank Sivantos. Thank you all so much for traveling to meet with us and evaluate our head and neck fellowship program. I consider myself an original Miamian, having grown up here from the age of 7 to the age of 18. I then left for my years of secondary and tertiary education. I attended medical school at Columbia College of Physicians and Surgeons in New York City. I completed otolaryngology residency at the University of Illinois and the Illinois Eye and Ear Infirmary in Chicago. I then completed a fellowship in head and neck surgery at Vanderbilt University. The only place I have ever worked as a full-time faculty is at the University of Miami, where I came after finishing my fellowship in 1992. I've had opportunities to leave and could never bring myself to leave the great group of people that I work with here. I've had a wonderful career up to now at UM and really have had the opportunity to be mentored by some of the giants in head and neck surgery, including Jim Netterville, Jerry Goodwin, and Barry Wenig. I've directed the Head and Neck Fellowship for 20 years and took our fellowship through the accreditation process with the AHNS back in 2005. I've also co-directed our Head and Neck Division for the last 12 years. On a national level, I've been active in the AHNS and the Academy, and as Fellowship Director, I've been involved in the Advanced Training Council of the AHNS. I've chaired the AHNS Bylaws Committee in the past, and I've been active in the NRG Oncology Cooperative Group and its precursor, ACOSOG, before that. I ran an NCI-funded pathologic validation trial, which was a huge project, studying sentinel node biopsy in the past and validating every patient with a completion neck dissection. And I've been involved in the current NRG trial, HN006, which I like to think grew out of that trial, which randomizes patients to sentinel node biopsy versus neck dissection. And that trial's PI is Stephen Lai, who's from MD Anderson. My involvement in that trial has included personally overseeing the development of a shoulder function quality of life instrument for Spanish-speaking patients, and I'm involved in the quality assurance committee of that trial. I've been around for a while, and I have contacts at many of the academic programs around the country, and I definitely try to put that to good use when our fellows are looking for jobs. We go to bat for our graduates, and have had tremendous success placing our graduates in academic positions in geographic locations they favor. I was also very involved in the ECOG 3311 trial related to transoral robotic surgery and de-escalation of adjuvant therapy in intermediate risk patients. That trial was chaired by Bob Ferris from Pittsburgh. We're currently developing a new trial that will involve neoadjuvant treatment prior to robotic surgery in the hope of reducing the amount of radiation patients need postoperatively. That trial will likely generate more patients for robotic surgery for the fellows. My current practice is a nice mix of cutaneous malignancy, oral and oropharyngeal cancer, and head and neck cancer in general, mucosal cancer in general, and endocrine surgery. Along with my partners, I contribute significantly to the volume of surgery we bring in, which obviously is the most basic part of what a fellow needs to achieve head and neck surgery training. I look forward to meeting all of you and answering all of your questions. Thanks again for your interest in the University of Miami.
I'm Jason Leibowitz, co-director of Head and Neck Fellowship, and I'm talking a little bit about myself in the program. So I trained at Penn, and then I did 2 years of fellowship here, and I've been on faculty now 14 years. I have a fairly high volume practice of traditional head and neck cancer, parotid, thyroid, and flaps. Fairly busy, which is a great thing because you really see everything here. As you can see, I'm sitting on our robots. It's a great seat. What's really great about this program as a fellow is the volume of cases, the diversity of cases. You'll really see everything and anything, especially from the private side at the university, and then you run your own clinics and have your own ORs at the county hospital. So you'll see super early disease, super advanced disease, reoperations, difficult necks and resections, as well as advanced microvascular technique. You have a lot of autonomy, but it's guided autonomy, so you're able to make decisions and really work with the faculty to get those skills of how to assess patients both pre and post-op that if you're just operating all the time, you don't get. We have a robust flap program. So most fellows will finish the year with 100 flaps each. We do a ton of robots, a ton of traditional head and neck, cancer, parotid, thyroid, etc. But also the smaller cases, which are foundational to your practice, like panendoscopies and biopsies, open biopsies, which most fellows will come the last month or so because they want to see it. In terms of the faculty, we are now 9 faculty members. We have a 10th coming on, so we're a very huge division. So you'll learn multiple ways to do the same thing so that you can decide what's best for you when you get out. Our fellows usually get their either top 1 or 2 job choices, with the majority going into academics. We have a very strong national presence, so we have a lot of connections to help you get those jobs. And if you're applying from the University of Miami Fellowship, you're a known product. You're known to operate well, to operate efficiently, and to have really seen everything and anything. We have a great alumni network who are advancing in their careers, who are now vice chairman and chairman and division chiefs and presidents of national societies, chairman of committees for national societies, etc. So really have that strong presence. So this is really a great fellowship. You have really kind people, nice people that are invested in your future. I always tell this anecdote that when I was a fellow, I got a call on a Saturday morning from David Arnold, and I figured he wanted me to do a trach for him or something else. And he's like, no, hey, you want to come on my boat? So I asked him, how can you do a trach on a boat? Because I was so used to this old model of the fellow doing all the grunt work. It's really not how we try to run our program. We want the fellows here as junior colleagues. We're invested in your education and in your future and in getting you the best possible job once you get out.
Hey everyone, and welcome to Miami. We're excited to have you here and hope your day goes well and that you are able to really learn about what a great fellowship this really is. There's so many things that we can talk about and will talk about during the day. The things that I would highlight, though, are just the number of faculty that we have and how well connected we are nationally, both in terms of our professional societies, particularly the HNS, as well as the Academy. These are great ways for you to get your academic career jump-started when you finish, to get involved in committees and projects through the societies, especially the HNS. It's just really helpful to have sponsors that you know, and you certainly have that with our faculty here. Just as importantly, we have trained a lot of people around the country. We know a lot of people, and that comes in very handy with regard to your job search, successfully pursuing that important aspect of the upcoming year. Getting a competitive job is more and more challenging year in and year out. Every year is different, but our fellows have consistently gone on to the positions that they wanted. I think that's a testament to the reputation of the fellowship, the reputation of our program in general, and it's a huge plus to have in your back pocket as you finish training and move on to that next important step. So welcome. Don't hesitate to reach out to any of us with any questions that you may have. We love to talk about the experience because it truly is a great one.
Hi, I'm Zuka Sarji. I'm one of the alumni of this fellowship. I did this fellowship in 2006 and 2008. I did both ablative and microvascular. I'm a skull-based surgeon, a head and neck surgeon at heart. I love this place. This has been my only job since I graduated, and I've been here ever since. This allowed me to super subspecialize in sinonasal cancer and skull-based surgery. This is one of the most well-rounded fellowships and the busiest fellowships you will ever be able to apply to. I love my partners. If you match here, you are guaranteed to be a top-notch multi-talented head and neck surgeon.
My name is Larissa Sweeney. I am one of the head and neck attendings here at the University of Miami. Wanted to thank all of you guys for having an interest in being a part of the University of Miami family. We're excited to meet you. So I am passionate most about doing free flaps. So that is where I focus a lot of my research and clinical interest. I have done a lot of chart review, retrospective, clinical outcomes types projects. The ones that have been most successful are the ones that I've been able to collaborate with my friends and colleagues across the country. That has allowed me to build a nice network of friends within our field and presented itself with an opportunity for me to get more involved with the H&S, where I am currently the chair of the reconstructive section. That's been very exciting and I've really enjoyed that. I am also heavily involved in AAO from an education and program standpoint, and recently became a test writer for ABOTO. I present and attend many national and international meetings because I really enjoy staying connected with individuals that have similar passions, and also it allows me to connect with friends and keeps me excited about the field and staying engaged in the future of our field is from a research standpoint and an education standpoint. So thank you again for showing an interest in the University of Miami.
Good morning, everyone, and welcome to Miami. I'm so excited to meet you all later today. A little bit about me. My name is Liz Nicoli. I have been at the University of Miami since completing fellowship in 2016. Prior to coming to Miami, I did my residency at Penn and my fellowship at the OGM-USC, and I've been here ever since, and I've loved every minute of it. My practice is a little bit of everything, which I think is most of our practice here. Love free flaps, love tours. Basically just the OR is my happy place. So I'm excited to share that with you all if you come and train with us. Outside of the OR, my other roles include residency program director, so obviously very involved in education and training, and I think that extends to the fellows for sure. We have great residents here at the University of Miami, and you're going to get to interact with them quite a bit in your role as fellow. And outside of all that, probably the hardest job that I have is mom. I have 2 boys, 6 and a 3-year-old, and I got to tell you that any free flap complication pales in comparison to trying to single parent these boys when my husband's out of town. So keeps my life in perspective for me. But anyway, can't wait to talk to you guys later today.
Hi, I'm Erin Kay. I am an assistant professor in the Division of Head and Neck. So I've been here for 3.5, almost 4 years now. I did both med school and residency at UM. And then I did my fellowship completed in 2022 at Penn in head and neck and micro and tours, of course. So just a little bit about my practice. I am both at UM and Jackson. I both have a clinic there at Jackson, and it's a great place to train because it's a very resident run and fellow run clinic. So I'm sure the fellows will tell you this, but they also have their own clinic, and they also get big things that come through their clinic and consults. And what's great is, they have myself, or Dr. Nicoli available to be the one to help staff some of these big cases or run some of these complicated cases by, because the patients that come to Jackson are not your typical head and neck. They're what we call, those T5 tumors. So my practice is the full gamut, but I would say probably the fellows know me best as like Jackson, flaps. I do tours as well. I trained at Penn, so we did a lot of robotic surgery. And then a little bit about my research. So I do a mix of clinical research and also some translational research. Probably what I'm most known for is my head and neck tumor bank, that I'm the clinical side of a translational pairing with one of my colleagues in neurotology, Christine Din, who has a basic science lab. So we harvest tumors and we culture them. And right now we're currently working on building skin organoids, which is pretty cool. I also am the survivorship lead for head and neck. So we started a survivorship clinic just about a year ago as partnering with the Sylvester Cancer Center. And so I do a lot of survivorship and survivorship research Lastly, I wear another hat. I am clerkship director for the medical students. You'll definitely be seeing a lot of med students rotating, and it's a really good opportunity for teaching. And if you have any interest in medical student education, you can always come find me and we can talk about ways for you to contribute. And then lastly, I just want to talk about one of my favorite things about this fellowship and also this program. So, I was a resident here. I did go away for a year, but I came back, and I feel like our environment is so collaborative. Like since day one, I could be doing a complicated case, and I could just walk into one of the ORs next door and ask one of my partners, what do you think about this? And everyone is so collaborative and collegial, and I really like that piece. I feel like everybody values each other's opinions, which is really nice. And the last thing I almost forgot to mention that I would be remiss not to mention is the fellows know me as the one person that doesn't use the microscope. So I use loops for micro, and you may not have 3-5 loops, you may not have 4-5 loops, and that's okay, but you do plenty of flaps with the microscope, so I always feel like it's a good tool to have in your wheelhouse to learn how to do them with just loops. And you'll definitely get more information from the fellows because it seems like they've really liked that experience too.
Our remaining faculty members are Dr. David Arnold and Dr. Elizabeth Franzman. On behalf of myself and all the head and neck faculty, welcome to the University of Miami.